Did you know that body contouring procedures are the most popular plastic surgery procedures both among men and women? Hi, I'm Dr. Mrinalini Sharma. I'm a plastic and cosmetic surgeon practicing in Aestiva Cosmetic Clinic, Saket. Today in this video, we're going to be talking about the 10 things you must know about female body contouring. Number 1, body contouring procedures help in reshaping almost any part of the body. So we can be talking about the arms, the thighs, the waist, you name it, we do it. The second fact you must know is that body contouring can take care of not only excess inches in terms of weight loss, it can also take care of the shape of the body. So if you have any excess hanging skin anywhere in the body contouring procedures are the procedures to opt for. Number 3, body contouring results are permanent, which means that any excess skin which we have taken out during a body contouring procedure, say a tummy tuck or an arm lift or a thigh lift, the results are going to last you a lifetime. Having said so, it is very important to ensure that you don't pile up on calories and follow a healthy exercise regime. Point number 4. So what comes to your mind when we talk about body contouring? Obviously, the most common areas are the tummy and the thigh, but body contouring can take care of a hell lot of other areas too. So if you have facial fat or your neck seems loose, your arms seem saggy, your buttocks seem droopy, all these are also targets of body contouring procedures. Depending upon the needs of the patient, we can cover the tummy, the back, the thighs, the arms, the calves and the face, all either in one procedure and more often than not broken down into multiple small surgeries. So when you walk into our office, we'll be assessing you as a whole and deciding आपको कौन सा procedure चाहिए, कितने combination of procedures करने हैं and कौन सा procedure आपके लिए अभी required नहीं है. The fifth point which you should know is why women only. So it's not that only women get to do body contouring procedures, but yes, they are the ones who opt for it more frequently than men. Why this happens is because it's the woman who bears the child. So most of the changes which occur in the body are due to excess skin, and pregnancy does take a toll on a woman's body in the form of excess weight gain, also excessive hanging skin, especially in the tummy area. So what happens after pregnancy is that women tend to manage to lose the excess weight they have gained, but are often left with unsightly bulges, saggy skin and stretch marks, especially in the tummy area and sometimes in the arms and the thighs as well. So that is why women are more frequent candidates for body contouring compared to men. Point number 6, mommy makeover. What does it mean? Mommy makeover is a combination of procedures which are designed to try and return a woman's body to her pre-pregnancy and pre-childbirth physique. So it has an array of procedures which can be addressing different parts of the body depending upon the needs of the patient. So in a consult with your doctor, we'll be looking at you as a whole and deciding which part of your body needs to be given a tuck or a lift, or where do you need to lose the excess skin from. It can most commonly address the tummy, as in cover the area which is under your navel, and people complain of stretch marks in this area, also of a lot of saggy skin which they're not able to reduce despite reduced weight and a good exercise regime. So tummy tuck is the most common and the cornerstone of all mommy makeover procedures. In addition to this, there are other procedures like an arm lift, where again we deal with the excess arm skin. There is also a breast lift, which is again I would say the second most important component of a mommy makeover, जहाँ पे हम breast का जो shape है उसको change कर रहे हैं. Pregnancy और खासकर कि breast feeding के बाद ये होता है कि जो breast की fullness जो pregnancy के दौरान आई होती है वो चली जाती है and also breast लटक जाते हैं. So women are very concerned about this saggy appearance and उनको लगता है कि इससे उन्हें एक old look मिल रही है. So breast lift is again the second most common procedure we perform as a part of mommy makeover. Other than this, there are other procedures, खासकर कि जो ऐसी महिलाएं हैं जिन्होंने बहुत ज़्यादा weight gain किया pregnancy में. Some people do end up gaining almost 25 to 30 kgs. ऐसे patients में बाकी areas of the body में भी sagging skin आती है, जैसे कि thighs हो गए. In fact, some people also have a lot of fat on the back. फेस में सैगिंग आ जाती है. इन सब एरियाज को भी हम ट्रीट कर सकते हैं. जैसे फेस के लिए हम लोग नेक लिफ्ट कर सकते हैं, हम लोग से मिनी फेस लिफ्ट कर सकते हैं, नॉन सर्जिकल टेक्निक्स यूज़ हो सकती हैं। फॉर द थाइज़ हम थाई लिफ्ट कर सकते हैं, थाई लाइपोसक्शन कर सकते हैं, बटक ऑगमेंटेशन कर सकते हैं क्योंकि जो आपकी बटक की जो स्किन है वो सैगी हो गई है, ड्रूपिंग हो गई है, उसको भी हम प्रॉब्ली रिस्टोर कर सकते हैं यूजिंग ईदर सिंपली अ फैट ग्राफ्टिंग एज इन द ब्राज़ीलियन बट लिफ्ट और अ प्रॉपर gluteal lift procedure which is also done in some patients where it is required. So कौन सा combination of procedures आपको सूट करेगा वो हम determine करेंगे consult के दौरान and then we'll chalk up a game plan for you and follow it in accordance with your needs and your convenience. Point number 7. In most cases, body contouring is not restricted to just one area of the body. So a person, especially a mother, a young mother will have concerns not only about her tummy, but maybe also about her arms, her breast and her buttocks. So transformations are most visible when we are addressing all these areas so that the woman gets an overall proportionate body. Point number 8. Simply because the woman needs a lot of procedures doesn't necessarily mean we need to combine all the procedures. We can also design a plan in which we're combining 2 or 3 surgeries together depending upon the extent of the surgeries and depending upon the anticipated downtime and the woman's schedule. Point number 9. Body contouring does not necessarily mean removing excess weight or excess skin. It can also mean selectively increasing or enhancing certain areas of the body. तो जैसे कि हमने डिस्कस किया कि प्रेगनेंसी के बाद ब्रेस्ट का वॉल्यूम गिर जाता है, ब्रेस्ट में सैगिंग हो जाती है, तो कुछ पेशेंट्स ऐसे हैं जिनमें हम ब्रेस्ट को लिफ्ट करने के साथ साथ उनकी वॉल्यूम भी बढ़ाएंगे. इसको हम फैट ग्राफ्टिंग के द्वारा कर सकते हैं या इन सम केसेस इम्प्लांट्स यूज़ करके कर सकते हैं. तो सही जगह पर सही आकार और सही वॉल्यूम देना, that is the aim of a body contouring surgery. Similarly, in buttocks also, many patients are going to do well simply by increasing the volume in the buttock using fat from your own body, a procedure which is commonly known as a Brazilian butt lift. So, body contouring simply doesn't mean removal of tissues, it actually means well proportionately distributed tissues in the body to give you a desired shape. Point number 10. So, every body is different. Every person has a desired body type and a desired shape. But when we're talking of a body contouring procedure, we're essentially aiming at the most desirable shape by most women, that is an hourglass shape. What does an hourglass shape mean? It means that your waist should be narrow, your gluteal region or your buttocks should be proportionately maybe more lifted and wider as is preferred by more females, and also the breast area should have adequate volume and adequate projection. So what we're essentially aiming to give you is an hourglass figure. So hoping to achieve a hourglass figure or a dream body, you can book an appointment with us at the numbers provided below. Also meet us at Aestiva clinic where we'll be happy to welcome you and answer all your queries. Thanks for watching.